Good morning, good afternoon, good evening, from wherever you're watching us from. Tunakaribisha sana in yet another episode of Ask Your Gyna series. We are excited to have you, and today we have a lot in store for you. But before we get into the topic for the day, I'd love for us to meet our incredible Dietary, who is going to be introducing himself. Dietary, over to you.
Thank you, Lena.
Karibu sana.
As always, I'm always happy to be here,
Mhm.
ready to answer to the questions that our viewers are asking. I'm your gynecologist, Dr. Karanja. I practice in Mombasa, but I do share videos and health information to everyone in this world just to try and demystify the myths and the misconceptions about different topics that are in gynecology and also in obstetric.
Yeah.
So I believe you have a topic for me today
Oh, definitely.
that is very rare,
yes,
rarely talked about.
very.
I'm ready for it.
Yes, and we are excited
Yes.
because we know we're going to be getting a lot of answers because
Yes,
kuna
yes.
maswali pia yamekuja na hiyo topic. And the topic for today is preconception care and the
Preconception care.
importance
Yes.
of pregnancy visits.
Okay.
Okay?
I'm ready for it.
Yes. So, just to start us off, kindly expound on exactly what we mean by preconception
care.
Yeah.
Okay. Preconception care, first of all, thank you for that topic because
All right.
it's rarely discussed.
Yes.
And sometimes it's the problem of us as medical staff who don't advise women to come for preconception care. But basically what it means is you come to your medical practitioner or to your doctor or to your gynecologist for a visit before you get pregnant.
Okay.
So you have not conceived, you are planning to conceive.
Yes.
Let's say 2 months before, 3 months before.
All right.
So you visit your healthcare provider. So they provide care. So we call it preconception care. The way you do antenatal visits when you're pregnant, you're supposed to do also preconception visits.
Interesting.
Yes. So it's the care of a woman
Yeah.
who's planning to conceive.
Yeah.
Yes.
Because most women will not even think that far. They will only go to the gyna after they have discovered
the
pregnancy. Yes.
And that is very wrong.
Wow.
Very wrong. I usually like to give the analogy of like right now we are in the festive season.
Yes.
People are traveling.
Yeah.
So assume you're traveling with your private car. Before you travel, what do you usually do? Because it's quite a long journey.
Yeah.
So you'll make sure you have enough fuel in your car.
Yes.
Everyone will service their car before they travel.
Yes.
You have to go check the oil, check the brakes, check the steering is working before you
travel.
That is what preconception care is. You don't start the journey, then you reach in the middle. Now you go to the mechanic to check your car.
Yeah.
You start before. That is what preconception care is. So all women should start before you get pregnant. So before you start the journey, you go check if that body is ready to get pregnant.
That is so... The way you explained it, it makes a little bit more sense now.
Yes.
Because we take it very lightly. Honestly, personally,
yes.
me being one of those people, I've never really thought about it until it actually like came into my mind, and I'm like, wow, okay.
It's very important.
It's a beautiful way to plan the whole journey.
The whole journey. Because pregnancy is a journey. It's actually 9 months. Then after delivery is also part of the journey of pregnancy. So that journey should be started before you get pregnant.
Okay.
Yes.
So, okay. So now that we've established how important it is there specific lifestyle changes that someone is supposed to make? Diet changes? Please tell us more about it.
Now, when you come for the visit, there are many things we do handle.
Yeah.
You've mentioned lifestyle and diet, but I believe we'll go through the whole list of what we do.
Mm-hmm.
But in terms of lifestyle changes, nothing special. It's just what we advise almost every day.
Okay.
Of course, exercise. Take your balanced meal.
Mm-hmm.
You know, we have the carbohydrate, the proteins, and the vitamins. But what we shall advise, reduce on carbohydrates.
Oh, okay.
Concentrate on the vitamins, that is the greens,
Yeah.
the fruits, of course, the proteins.
Yes.
But try to reduce on the sugary foods.
Okay.
By sugary foods, we mean mainly carbohydrate. When you talk of sugar, we don't just mean sugar itself. Yes. Because once you take carbohydrate, it is converted into sugar in the body.
Yeah.
So when you talk of sugar foods, we mean carbohydrate.
Yes.
So you moderate on that. And the best thing to do is, you as an individual, when you visit your gynae and the nutritionist and all the other multidisciplinary team, we will individualize that diet to you.
Oh.
Yes, depending on your weight, depending on the medical conditions that you have, and also depending on your pocket.
Okay.
Because we cannot advise you to take what you can't afford.
Yes.
Yes. So that is part of the diet.
Yes.
So apart from exercise, we have these recreational drugs, we have alcohol, we have smoking. Those ones you have to cut down. If possible, cut completely. But we'll go into the details of that.
Okay.
Yes. But the first and foremost thing is lifestyle changes and dietary changes. After that, now we go into the tests, and if there are any treatments we have to give you, that is what we handle the next.
So in additional to the diet plan and exercise, is there a requirement for supplements? Someone to take supplements to boost the process?
Supplement is a hot topic.
Okay.
And it's a whole big market outside there for supplements. But the most important supplement we advise is folic acid.
Okay.
Yes, you can miss on all the other supplements,
but that one,
folic acid is a must. And you take folic acid with the right dose. There's the right dose we do prescribe for folic acid. Now, there are those women who, if you're not at any risk, will give you the normal dose. But there are those women who've had pregnancies before, and maybe their babies had congenital problems. Maybe the baby is born with abnormalities in the organs, the brain.
Okay.
We give them folic acid at the higher dose.
Oh, so the dosage is dependent on factors.
Dependent on factors,
okay.
Yes.
Okay.
But for a normal woman, no problem. We just give the normal dose of folic acid.
Okay.
There are other supplements that we do give, but now that depends with the individual patient. You don't just give supplement to everyone. Yes. Now, number 2, there are supplements that women take outside there for whatever reasons.
Yeah.
Either for vaginal flora, for they have chronic conditions that is making them take the supplements, cartilage, creatine. There are those supplements which are not good for the baby. So when you're trying to get pregnant, we'll advise you to stop those supplements. Okay. Yes. But point home is the most important supplement is folic acid. Yes.
Wow. Okay.
That is the most important supplement that you need.
And how does folic acid help?
Now, folic acid is involved in, let me just put it in general, in cell division.
Oh.
You know, when you get pregnant, you will not know when you get pregnant. You will know when
you've tested. And to the gynae.
And that is like 2 weeks.
Yes.
Earliest 2 weeks, because that's when you'll miss your periods. But for some people, they wait. Maybe they say their periods have just delayed. That's another week.
Wow.
So there's some women who take 3 or even a month
before
to know that they are pregnant.
Yes.
By that time, the baby's cells are dividing. The organs have started forming. You need folic acid in that process of cell division and organ formation. Because if you miss folic at that time, That's when the organs develop the wrong way.
Now that makes even more sense
Yes.
to do the preconception care.
Yes. You take
Because
folic
at
acid
least you get to start the process
Yes.
even before conception.
before
Yeah,
conception.
that's amazing. Yeah,
Because when you conceive, you don't know.
yes, you don't.
But you'll be taking folic at that time.
Yes, yes.
So folic is already helping you.
Yes.
By the time you know you're pregnant, folic is already working.
Yes.
Yes.
Wow, that's incredible. At least mtu ambaye alikuwa haelewi.
Yes.
Someone who wasn't understanding, at least now they are
Yes.
getting why we are so vested in talking about
Folic.
this. Yeah,
Yes.
this is okay. So apart from supplements, you
Yes.
talked about alcohol,
Yes.
smoking, and you said we will talk about it further.
Later.
So
Yes.
can we do that?
Now,
Yeah.
smoking is the enemy of everything, not just pregnancy.
Mm.
Yes.
Okay.
Hypertension, diabetes, chronic condition, cancer, arthritis, almost all conditions, because smoking affects your blood vessels. There's no organ in the body that is not supplied by a blood vessel.
Yeah.
So when you smoke for long, you affect almost
Everything.
But specific for pregnancy, women who smoke before and during pregnancy, they're at risk of placental abnormalities. Because what happens is the smoking affects the blood vessels of the placenta. Remember, there's a time we talked about preeclampsia?
Yes, we did.
Yes.
Yes.
Smoking can worsen it because it affects how the blood is supplied into the placenta
Yeah.
and into the baby.
Mm.
And there are many other conditions in pregnancy that smoking
affects.
is a risk factor.
Mm.
But preeclampsia, hypertension, having a small weight baby, we call that growth retardation.
Okay.
Meaning you're pregnant, but the baby is not growing at a good rate.
Yes.
Yes. So for smoking, we recommend you stop.
Completely.
You don't reduce.
You
stop.
Yes.
Yes. But of course, if you're already addicted, there are measures we will send you to the specialist for that on how they can help you reduce and then stop. Now, alcohol is a very tricky topic.
Mm-hmm.
The best is to stop.
Okay.
The best
Yes.
is to stop. Now, you can reduce alcohol, but you're reducing from what to what? You could be reducing from 15 bottles to 5
10.
bottles or to 10 bottles.
Yeah.
So we don't just say reduce.
Yeah.
Ideally, you should tell someone the amount of alcohol they should take.
Yeah.
And you should know which alcohol they take. Yes. Because beer, wine, whiskey, gin, they're different. And the percentage of alcohol is different.
Yeah.
So if I tell you reduce from 2 bottles to 1, what do I mean? Is it the whiskey or the beer?
Yeah, true.
So the topic of alcohol is a bit tricky. If you can stop, the better. If you can reduce to the minimum. Yes. Alcohol has no benefit in pregnancy. It can only harm you or the baby.
There's a myth that says that if you're pregnant and you take Guinness,
yes,
that it helps with the blood. Is that even true?
That's a myth. I've had that vibe before.
Yeah.
That Guinness helps the baby. No, it doesn't. It doesn't. and in case it helps, how much of Guinness will help the baby?
Yeah.
And what is it that is in Guinness that helps the baby? If we knew the content of what is in Guinness that helps the baby, then we will look for that somewhere else.
Yeah.
Not in alcohol.
Substitute it.
Yes. We'll substitute it with something else.
Okay.
Yes.
Wow. So that one is
so there's no benefit. There's no benefit. It's a myth.
All right. So you talked about exercise.
Yes.
What exercises are recommended?
Now with exercise, different people do exercise differently. So if you've been exercising, continue.
With the same.
If you have not been exercising and you're starting, so you don't start very strenuous, vigorous exercise. Because when you get pregnant, we'll tell you to tone down.
Okay.
So there's no need of starting very vigorous exercise. Then within 2 months, we tell you to
Stop.
Yes. So just start with simple exercise like brisk walking, jogging, doing some cardio in the gym. Okay.
Yeah.
Then once you get pregnant now, we will customize that to the pregnancy itself. Yes. Because we've managed women who are gym instructors and they continue with their schedule.
Yeah, because they are the ones who are training
Yes,
others.
that is their work. That is what they do every day.
Yes.
Their body is used to that. But with time, when you reach the second trimester, third trimester, there's a way you tone down on the exercise. Yes.
And about weight, you also mentioned it.
Yes,
what is
yes,
the
weight.
ideal weight?
The ideal weight, we don't have an ideal weight. We concentrate more on the BMI.
Okay.
Yes, BMI, you compare someone's weight and their height. So if your BMI is very high and maybe you're overweight or obese, then we have the ones who are in the middle and there are others who are underweight. So it's not only those who are overweight.
Yeah, even those that are
Yes,
underweight.
who are underweight.
Okay.
Your pregnancy is at risk.
Yes.
So once you come to the clinic, we take your weight, we take your height and the BMI, which is the most important.
Yeah.
And we also relate that to your diet and to your lifestyle. Now we can advise you to reduce your weight or to increase your weight.
Okay.
That's now where we bring in now the nutritionist and the other doctors.
Okay.
We know sometimes when you're overweight, you might be having other conditions.
Yes.
So we might also screen you for diabetes.
Yeah.
We might screen you for hypertension. So we have to manage that together. Because it's been shown, if you're overweight or you're underweight, there are some conditions or diseases that you're more at risk when you get pregnant.
Okay.
Including our topic of preeclampsia,
Yes.
hypertension. Yes. So when you get pregnant, you need to be at the optimum BMI, which we have a reference range for that. Now, the other thing of knowing your weight before you conceive. Now, once you conceive, we know your what we call pre-pregnancy weight. That pre-pregnancy weight is very important.
Okay.
Because now we will monitor now your weight during pregnancy. Because someone who is 80 kg, there's a way they're supposed to increase their weight during pregnancy, which is different from someone who is 60 kg and from someone who is 100 kg. Their weight should increase differently during pregnancy. There are some other drugs we give in pregnancy, and the way we calculate the dose, we use your pre-pregnancy weight to calculate the dose of the drug.
Yeah.
Not your current
weight.
We know when you're pregnant, so we use your pre-pregnancy weight. That weight is very important.
Okay.
Yes. Not just to manage the conditions, but also to help us calculate the dose of the drugs that we give you during pregnancy.
Yeah, because when you're pregnant, your weight is definitely going to increase because there's another being growing in you.
Yes.
That is why it's necessary to have the pre-pregnancy weight.
So it will help us manage and avoid conditions in pregnancy that might affect you or the baby, and also in calculation of the dosage of the drug. And the weight, they go together. Weight, alcohol, smoking, lifestyle changes, diet. We manage all that together. That's why you have to bring in the nutritionist, you bring in the physician, everyone in that table. That is part of the preconception care.
Okay.
Yes.
And there's also this myth of eating, especially for pregnant women.
Yes.
It's not a claim, but it's probably true. They're eating for two.
Yes.
So how does one get to align that? Is it, yes, it's true they're eating for two, but do they have to
eat a lot?
Eat in the way they're, you see, in our African homes,
setting. Yes.
Where these women are fed, Bana.
Yes, the mother is there. The mother-in-law is there insisting, you're not eating.
What would you advise regarding that?
This person that you're saying you're eating for two people.
Yes.
This other person, how big are they?
Not
Assume you're 60 kg.
Yeah.
The other person is not even a kg.
Yeah.
So why are you eating for
like two people
for
who
two
are
people?
the same
What we shall advise, just eat
normal
balanced diet. Of course, remember, cut on your sugars.
Yes,
You reduce the sugar bit and the carbohydrate. But of importance, as the pregnancy progresses, you're advised to take small, frequent meals.
Okay.
Yes, not just breakfast, lunch, supper. No, you take small, frequent meals so that you maximize on the nutrients. And also, during pregnancy, the first trimester, you have a lot of nausea, you have a lot of vomiting. So it might be very difficult to eat a lot of food.
Yeah.
So you can eat small, frequent meals.
Mm.
Now, during the second and the third trimester, again, the tummy is growing.
Yeah.
And everything is being pushed on the side.
Okay.
So even your intestine cannot accommodate
a lot
of food.
Okay.
So you take small, frequent, balanced
Very important
diet.
You don't look
It's
for
not about the amount.
to overindulge in junk.
No. Don't eat a lot.
Yeah.
It's because of no.
And it doesn't enable a lot of hunger spells
The small frequent meals.
in that process.
The small frequent meals actually is better.
Okay.
Than taking breakfast and then supper.
Yeah.
Yes.
It's better to feed in between.
Okay. But
healthy.
What you feed, healthy.
Okay.
Yes. Very important.
Yes.
Is what you feed in those frequent meals.
Okay.
Yes.
So speaking of chronic diseases, we touched on it kidogo, but now let's go deeper into it. Someone who has some, maybe diabetes, thyroid issues, what would you advise? How do they proceed?
Now, during the preconception, before you get pregnant,
yes,
the reason you come to see your doctor is, one, maybe you already have those conditions. That's even better because we've started somewhere. They're already being managed. But we also do tests. Of course, we take your blood pressure, we check your sugars. Then we ask about the family history.
Okay.
Is there anyone in the family that has a condition that might run in families?
Okay.
Like fibroids, like pressure, any other condition. There are many. So we might screen you for that condition. Now, once we screen and we find you have a problem, let me give you an example of hypertension. Your blood pressure is high and you're on treatment.
Okay.
So we'll ask you, what drug are you using? There are some drugs which, when you use in pregnancy, it's risky for the baby. You're not supposed to use it in pregnancy.
Yeah.
So we stop that drug. Then we send you back to your physician, whoever is treating you the hypertension.
Yes.
And advise, let's stop this drug. Kindly give drugs that are safe in pregnancy.
Okay.
So even if you're on treatment, you still need to see the obstetrician, yes?
Yes.
Now, even for diabetes as well, many of the drugs that they're taken orally are not safe in pregnancy. So you might have to change the drug and also the dose. Same for the other conditions, thyroid, diabetes, hypertension, fibroids, almost all conditions. We have to know the drugs you're using and when do you want to conceive.
Okay.
Number 2 is, as much as you're on treatment, we have to make sure, I'll still use the example of high blood pressure. Before you get pregnant, your pressures have to be normal for some time.
Okay.
For 1 to 2 months, your pressures are normal and well controlled. Your sugars are normal and well controlled.
Yeah.
If you have a thyroid disease, the thyroid hormones are normal, well controlled before you get pregnant.
All right.
Because once you get pregnant, pregnancy distorts almost everything. It changes the physiology of your system.
Yes.
So it will be good, everything is balanced before you get pregnant. Yes.
So that it will be easy to manage the situation.
Yes.
Wow.
In case your pressures rise or your sugars rise, we will know it's because of the pregnancy.
Yes.
And not because the drugs are not working.
Okay.
Yes.
Oh, wow. Okay.
Very important.
And speaking of mental health and stress, what
Yes.
a pregnant woman should not be stressed. It affects the babe.
Yes.
Help us understand that.
Now, stress, there's the normal stress that we all have.
Yes.
At work, at home, children, But there's once something bothers you for long, that now becomes a mental problem.
Okay.
Like gender violence, depression. Maybe you've lost a job. Maybe you've lost someone very close. We shall advise you don't conceive when you're not mentally stable.
Wow.
And mentally stable, we don't mean someone who is
completely
psychotic. Yes. You can be very normal, you're doing your work, but you're mentally not okay to get pregnant.
Yes.
So for such cases, if we see that it's severe, we have to involve now the psychologist or the psychiatrist who will help us manage that part until when you're stable, then you get
start the journey
pregnant.
Of pregnancy.
Because pregnancy itself can be very draining. The symptoms of vomiting, the symptoms of nausea, the symptoms of not wanting to eat anything, they can be very draining if you're already mentally not stable.
Yes.
Yes.
So it will make it worse.
It will make it worse. Yes. And also we'll screen you and see if are you ready to actually get pregnant.
Yes.
We'll also ask you in the previous pregnancies, if you've conceived and delivered before, did you have any mental issues during pregnancy and after delivery?
Yes.
You've heard of postpartum blues, postpartum depression, postpartum suicidal thoughts. So in the next pregnancy, it can actually get worse. So we need to manage that before you get pregnant, just to avoid it worsening in the next pregnancy.
Okay.
So it's very important, the mental bit.
Very.
Very important.
Is this a topic for another day if I ask how that stress and mental health problems is going to affect the baby? Like how?
Now, you see, when you're pregnant, you have to be, the mind controls the whole body.
Okay.
The mind will control how you work. The mind will control how you remember your clinic visits.
True.
The mind will control how you're taking your drugs. Because when you're stressed, you can even forget when to take your...
Yes.
When you're mentally not okay, it will affect your feeding habits.
Okay.
What you eat, when to eat. There are those people who don't want to eat when they're not...
And there are those who overeat.
And there are those who overeat.
Yes.
Yes.
Wow. Okay.
So it's a big topic, which when we discuss, it will even be fair to have a psychologist.
Oh, okay.
Yes. So that now they can go into the details of what can we do about it.
All right.
Yes. And the effects also on the baby and to the mother.
Yeah, because that one I'm curious about. We'll have to make...
Yes, we can organize a session for that. Yes.
So speaking of genes now.
Yes.
Genes, genetic. When someone is planning this pregnancy journey. So how does the clinic help someone?
Now, when you want to get pregnant, there's some questions we'll ask you about your family, about yourself. Do you have members of your family who have some genetic problems? Let me give you an example. If your baby had your previous pregnancy, maybe baby had hydrocephalus. You've heard of hydrocephalus? When the head is very big.
Oh. Okay.
Babies who are born with very big head and there's a lot of fluid in the brain. We can prevent that from occurring in the next pregnancy. If they had brain problems, we can
Yes.
prevent that from occurring in the next pregnancy.
Yes.
And that's where our supplement comes in.
Oh, yeah.
The folic.
Acid.
Yes. Now, in other countries, there are some genetic conditions which are common in certain groups. You might find among the Indians, a certain condition is common. Among the Israelites, a certain condition is common.
Mm.
So you want to know this person is from which ethnic group.
Yes.
And which conditions are common among them.
Yes.
And you want to prevent that from occurring in their babies.
Okay.
That's why genetics is important.
Mm.
We don't just test all genetic problems. You can actually come and we just ask you about your family, where you come from, and we don't do any tests.
Mm.
And that involves both you and your
And
partner.
Your partner.
Yes.
Okay.
So it's not a must we do those genetic tests.
Mm.
You must get something that is suggestive that there could be a problem.
Okay.
The other thing we usually look at is the blood group.
Okay.
I'm sure it will come later, but let me just mention it.
Yes.
It's good to know your blood group. And more so for those who are rhesus negative. You know, when you tell you your blood group is AB, and O,
Yeah.
there's something else we usually add. We say A positive or A negative.
Mm.
O positive or O negative.
Yes.
So if your blood group is negative, then it has implications in the pregnancy.
Wow. Okay.
And more so if the mother is negative and the partner is positive.
It has implications.
It has implications on the baby.
Okay.
Because the baby can take up the blood group, the rhesus group of the father. So if the baby is positive, the mother is negative, there are some things that can happen to the baby that are dangerous to the baby.
Oh, wow.
So we need to know your blood group and we plan how we are going to manage that pregnancy. There are even injections you'll get during pregnancy to avoid certain things happening on the baby.
Okay.
So if your blood group negative, it's important. And you can only know if you test.
Sure.
So when you're planning to get pregnant,
you have to
test the blood group.
Wow. These are very serious things.
Yes.
Are not really taken seriously.
Yes.
Anyway,
I think even as health workers, we've not sensitized people enough.
True. People are not aware. People think it's just, I'm pregnant, I'll just give birth and life will go on.
Life will move on.
And then complications come along the way and you're wondering
what happened.
Yeah. Kumbe, if you had done preconception care, you would have avoided
completely.
And about screening for like STIs, is that done?
Yes. Screening for STI is done. First, we usually take a history. History means we'll ask you, have you been having discharges? Have you been treated for an STI before, sexually transmitted infection? So from the history, you might be able to pick if you've been at risk before. So we can actually screen for STI.
Okay.
And there are some three, you know, when you get pregnant, when you go to the clinic, there are many tests that are done. But there are three important infections we test.
Okay.
You have the HIV test, which of course is sexually transmitted.
Yes.
You have the syphilis test, also sexually transmitted, and hepatitis B virus, which has many ways of transmission. Now, the reason you test for these infections, when the mother gets pregnant, the baby can be infected. So there's transmission of those conditions to the baby.
That's very, very
So the baby might get HIV, the baby might get syphilis, the baby might get hepatitis B. So the reason we screen you is we treat you before you get pregnant.
Yeah, so that you don't risk the baby.
You don't risk the baby. And in case you've already conceived, we screen you, we treat you early.
Yeah.
Before the pregnancy
is advanced. Okay.
And we treat it so that the baby does not contract. Yes.
Okay, so what are the tests that anyone who is coming to consult given? Like
Yes.
generally,
In
all
the preconception.
Yes.
Now, the test that you do during pregnancy must be done before pregnancy. Yes.
Okay.
One, we check your blood level.
Okay.
We call it hemoglobin. So if your blood level is low, it will be wise to increase it before you get pregnant.
Okay.
Because once you get pregnant, the baby is demanding from you.
Yes.
You have to supply to the baby.
Yes.
So we want to optimize your HB to be above 10, 11, preferably above 11.
Okay.
Most of our women, more so the coast region, their hemoglobin level is less than 10. Because of dietary factors, of course, the monthly periods, some have heavy periods. So we do hemoglobin test. Number 2, I've mentioned the blood group.
Yes.
Very important. Number 3 is those 3 infections, HIV, syphilis, and hepatitis. That one we must do.
Okay.
And if we find it's positive, we have to treat.
Yes.
Before
Conception.
you get pregnant. Okay. We have to test your sugars.
Okay.
So we do a fasting blood sugar. That is just to screen you in case you're at risk of developing diabetes or in case you have diabetes.
Okay.
Because you might come with screen, we find that you don't have diabetes, but you're also not very normal.
Okay.
You're in between. So you're at risk of
getting it.
So we do preventive measures so that you don't get it.
Okay.
Of course, we'll check your urine. Urine tells us a lot about your body.
Okay.
Yes, including infections, including kidney disease, many things. Because your kidneys filter everything that comes from your body.
Okay.
So the urine tells us what is happening in the body. So the urine test is important. One other test that most people don't do, but we encourage to do is the thyroid test.
Okay.
Yes. So we do what we call thyroid hormone tests. But for screening, we only do one test. It's called thyroid stimulating hormone.
Okay.
When you find that one is normal, there's no need for doing the other test for the thyroid. If we find it's either low or high, then now we do the other test to screen if you actually have a thyroid disease or not. So those are the 7 tests we usually do.
Okay.
And the same tests are done when you get pregnant. Yes.
Okay, so when I've conceived,
yes,
what is next for me?
When you've conceived.
Yes. Now that we have done the preconception care, we have started on the journey of conception and I have conceived. So what next?
And you're taking folic?
Yes.
Okay. Now, once you conceive, and also let me also demystify this misconception, which unfortunately, even us as health workers, we tell women. You find a woman going to the clinic at and says, "I'm 1 month pregnant. I want to start my clinic." You'll actually find health workers telling the woman, "You've come so early. Why the hurry? You go and come when you're 20 months. No, not 20, 20 weeks.
Yes.
Not 20 months. Come back when you're 20 weeks pregnant." That is very wrong. And maybe I should speak to my fellow health workers out there. Our nurses, our community health promoters, our community health workers, our reproductive health providers, our clinical officers, our medical officers. We advise all women who are pregnant to visit the clinic once they conceive, whether they are 2 weeks pregnant, 1 month pregnant, 2 months pregnant. Start clinic early, do all the tests early, and do a scan early. It helps. That is when the baby is developing.
Yeah.
That is the most important part of we call it organogenesis.
Okay.
The organs are forming. it's the most important time.
Mm.
That is the time you'll tell the woman, don't take any drug until you ask your doctor.
Yeah.
Don't go to any chemist and just buy the
Yeah.
over-the-counter drugs because you're pregnant. That's the time you start them on folic if they have not started on folic.
Mm-hmm.
That is the time you screen them, the test we've talked about,
Yeah.
and you start treating in case there's a problem.
Wow.
So the earliest you start the clinic, the better.
Yes.
I hope that message has been...
I hope so.
Yes.
Because yes, there's that tendency of being told, it's still early. Utaenda tu, ukisonga, utaanza kwenda. Because now, the seriousness of the matter is... Yeah. So, thank you for making that very clear.
That is very important.
For anyone who is listening, I hope you take heed of that and you tell your neighbors and their neighbors because it's important.
Very important.
All right. And I'm assuming the regularity of the clinic visits will be determined by the attendant.
Yes.
Right?
Now, we currently, internationally, we advise 8 visits.
Okay.
When you're pregnant.
Throughout the period?
Throughout the pregnancy period.
Total 8 visits?
Total 8.
Okay.
But it can only be 8 if you come early.
Okay.
You see, when you come for the clinic at 6 months, there's no need having 8 visits.
Yeah.
Yes, because these 8 visits, they are scheduled. In the first trimester, we have a certain number of visits, second trimester and third trimester. And each visit has a reason.
Okay.
Yes. There's that, the first visit we screen for everything. Then the subsequent visits, each visit has a reason.
Okay.
And there are things we do in every and each visit. We check your weight. Always check your weight.
Yes.
To know how the weight is increasing.
Yeah.
It should not be too much. It should not be too low. There's a curve we use.
Yes.
On how the weight is increasing. Because the weight can predict some diseases in pregnancy. We have to check your blood pressure. A must. Is it reducing or is it increasing? Okay. Of course, the pulse rate, that one has to be checked. The medical provider has to examine the tummy.
Okay.
If the tummy is growing. Because there's a way we measure. We know that this is 20 weeks, 22 weeks, 24 weeks. If we find it's not growing at the same rate with what we're expecting, we might think there's a problem. Then we send you for a scan. And we also do a examination of the whole body. Because there are changes that occur in pregnancy that we can detect from just examination. Then after that, now we might decide to send you to check either your blood level or your urine or any other thing that we might find necessary. So each visit, something different. But there are those common things we do for each visit.
Okay. Thank you so much.
Karibu.
This was very detailed and very well articulated. The importance of preconception care. It is very important. For a healthy child and a healthy pregnant mom, it's very important. So just to finish us off, what would be that one thing you'd leave us with? Yes.
Preconception care is a must. And let conceiving be not an accident. Let it be a journey. I know many women conceive without knowing. Maybe because of the life that we live. Pregnancies are supposed to be planned. Pregnancies are supposed to be intentional. I want to get pregnant in January.
Yes.
So let me go see my gynae in November or in October so that we plan this journey. Like what I said before, if you are traveling a long distance, you have to check your car. You check if the oil is enough. You put fuel. You check the tires are working. You check the lights are working. Before you start the journey, same as pregnancy, you need to check your whole body if it's normal and okay before you start that journey of pregnancy. Pregnancy should not be an accident. It should be planned, should be intentional. And that's why we insist on preconception care.
Yes.
Meaning you come to the clinic before you get pregnant, so that we try and see if there's any problem or if there are any danger signs. We treat them before you get pregnant, and you'll have a smooth pregnancy. Thank you so much from Dr. Karanja, your obstetrician gynecologist. You'll find us on our social media pages. We're on Facebook, we are on TikTok, we're on YouTube.
Yeah.
And we share educational videos, health information. We try and educate you on everything gynecological and everything obstetrics.
Wow.
And thank you so much, Lena, for having me today as well.
Yes.
Yes. I'm always ready to come back.
Karibu sana. We love having you here.
Asante.
Plus, you need to tell us where we can find you physically, apart from the online.
Yes. Physically, I'm at Jubilee Building, Modern Gyno Clinic in Mombasa. Jubilee Building, first floor, office 1A2. And we've also shared our contacts. You can call us.
Yeah.
Yes.
So, usiseme ukuambiwa. Dietary is very much available, and you can always reach out to him through the contacts that will be shared on the screens. Apart from that, you can just get a lot of information from the YouTube channel, because there's a lot to learn about women health generally and all these other topics that we've been talking about. Otherwise, we are very grateful that you're able to join us today. I hope you got to take home a lot of gems. Vile uliingia when we began should be very different from the way you walk out of this beautiful session that we just had. So thank you so much for allowing us to grace you with our information. And we look forward to seeing you in our next session. And Mungu azidi kuwabariki.
Amina.
Yes.